Welcome to the Counselling Tutor Podcast, the must-listen-to podcast for students of counselling and psychotherapy. Here are your hosts, Rory Lees-Oakes and Ken Kelly.
Hi, I'm Rory, and with me, as always, is Ken. How are you doing, Ken?
Exceptionally well. Delighted and grateful to be here, Rory. And we are delighted and grateful that you've joined us for the Counselling Tutor Podcast. This is episode 210. And we're going to have 3 stops on our journey today. We're going to start at Counselling Foundations, where we look at the basics that we build our counselling practice on. And in that section, we're going to be speaking about the attending when a client first arrives. Then we're going to go into the focus on self, and that's because we recognize that you are the heart of your practice. We need to look to self first in order to be there fully for others. And today we're going to be speaking about showing emotion, and more specifically crying with our clients. What's your thoughts on that? And then of course we're going to be going on to practice matters, which is where we dip our toe into something that we may come across within the practice, the day-to-day running of our practice and being a counsellor. And we have Sally Openshaw, who's going to be speaking about erotic transference. So a mixed bag, I think, today, Rory, and starting off attending to our listener with the subject of attending. See what I did there?
I did. Yes, very clever, Ken. And I think attending is one of those skills that is sometimes mentioned, but sometimes isn't given enough focus and importance. And I've always said, and those who've listened to the podcast, for a long time, will know that I compare the opening of therapy to the opening of theatre, where, the protagonists come onto the stage, the curtain opens, and there we have it, the beginnings of that engagement. And I think that part of that is to make sure that the client is comfortable. We're starting to build the process of therapeutic engagement, and we do that right from the beginning. And if I was thinking about my practice, when I worked face-to-face, I would say, things like that, did you get here okay? Or, good to see you, get here okay, in that 5 minutes. But also attuning to the clients. And when I say attuning, it's the process of, listening right from the beginning, the client's with you. And are they saying things like, well, I think the room's a bit too hot, or this chair's uncomfortable. Or they may, if you're having to move rooms for the colleagues who, or even, student colleagues who may use different practice rooms because of how they're booked out, maybe about picking up from the client, oh, this is a different room today. The room's different. And that is your cue to attend and say, yes, we have moved rooms. I was wondering, how this feels for you. Because, we are about producing safety, containment, and making sure that we're really in service of the clients. And that starts with attending right from the beginning that we meet them.
I love that you've brought this, Rory, and I agree with you that it is a topic that is seldom covered. I mean, I think you cover it when you're doing your counselling studies. They'll mention attending and kind of tell you what it is, and then you're going to move on. And the focus is all on what you do when you sit down and you start that engagement, your active listening, the skills you're going to use, the contracting you're going to do. But there's a part before that where you have this meeting with this person, maybe a new person coming in, maybe somebody returning after many, many, many sessions. There's an interaction, there's a human-to-human contact as you kind of meet that person as they walk into the environment, or you go and get them from wherever they are. And that is where the attending starts. Who are we within that moment? And you mentioned how we show up, and we're talking about that unconditional positive regard, not when they sit down and they start bringing their content. For them, the trip, what was going on in their life before they came in. And we need to recognize, specifically if we're working face-to-face within a room, a person has a journey to get there. They've got a journey they've gone through. If we're working online, they might have just come out of their day-to-day life. They could have been washing the dishes just 2 minutes earlier before coming down with us, and just checking in with that person. How are they? Where are they at? So important, that attending to that person.
Yeah, you're absolutely right. And I think attending goes through the arc of our engagement with clients. We may have a situation where we're working with a client, and I mean, I've had it in my practice, certainly as a student, where I was working with a client, and in the room opposite, there were loud and aggressive voices, and I felt I had to attend and just to check if the client was okay, and to reinforce that that person was safe, and to really acknowledge what was going on. I think sometimes there is a tendency for therapists maybe to kind of think, well, I'll keep focused on the clients and I won't think of the distraction. But sometimes, it sometimes literally can be an elephant in the room.
Yep.
It certainly was when there was a strong exchange of words in the corridor outside. And you need to address that. And I think crucially, attending is something that we do as we come to the end of the therapeutic session, when we're talking about that decompression, where we're helping the client adjust from the high emotion that may be expressed, the personal reflection they may carry, and we're helping them to adjust back into the world they came out of. So we have to be thoughtful. And examples of that could be acknowledging that they're going back into the world they came from an hour ago. And, even, if you're working like I am today, I've got the window, the blinds open, and, you can see it's raining outside, saying, oh, gosh, I notice it's wet outside, trying to normalize the environment they'll be going back into.
Yeah. I'm thinking of driving a car, and I'm thinking of the gear changes. And attending feels very much like those gear changes. And they come at different parts in the journey. So when somebody just arrives, they're changing gear to come into therapy, and there will be an opportunity for attending. Somebody knocks on your door mid-therapy, there is an opportunity to attend. The noise outside, the elephant in the room, as you called it, Rory. The movement from the therapeutic protection of the relationship within the room back into their life. What are they going back into? What does that look like for them? What does that feel like for them? Acknowledging that, and once again acknowledging that there is a shift in gear as that person moves on. And I know you've put together a super duper Rory handout for this, Rory.
Do you know, I have, it's true. And I think it's so important. And if you want that handout, if you go to counsellingtutor.com, look for the podcast tab, give it a click, you find it, it's top of the page, episode 210, that handout's waiting for you. Just give it a click and you can download it, and it will give you some really good tips and overviews and food for thought on attending. So it's such an important skill, Ken.
And I think very, very seldom spoke about or revisited. And maybe there's a challenge, specifically if you're a more seasoned practitioner. Revisit that. Have a think. Has that just become a blur of saying hi to the next client, or is there active attending taking place?
I like that, Ken, because I think attending, and I often refer to it when I taught as being present, means that you are actually the only person in the world is the person sat in front of you, that you can bracket off what's going on for you in the outside world, but totally focus on the person in front. And I think that's a mindset shift, because we all have busy lives, but I know that when I work online with clients, I actually make a point of physically shutting my door for a few seconds before I go online with them. Or even when I was face to face, I would sit in the room for a few minutes before they came, just to put myself into that kind of space of the person in front of me is the only person in the world.
I like it. I'm very grateful that you brought the topic, Rory. And again, this is why we revisit those counselling foundations. They're the foundations on which we build our practice. And every single one of the stones we lay on those foundations make such a big difference. So I guess moving away from our counselling foundations today, we're going to focus on self. That's where we recognise that you, as a practitioner, you're the heart of your practice. You know, we need to look after ourselves. We need to look after our own emotional well-being, our own self-care, in order to fully be there with clients. And the recognition with today's topic is that very often a client will bring in a highly emotional journey, and we are called upon to empathically walk with them as if seeing it from their frame of reference, through their eyes. And we can feel our own emotions change within that. Is it allowed? What happens? What is the protocol around shedding a tear with a client?
Exactly the questions that have been asked in our Facebook group. And if you, which is why I brought it, and if you're not a member of our Facebook group, type in Counselling Tutor into Facebook. You'll find us. We're a closed group. Knock on that door, and you'll be welcomed warmly by our wonderful moderation team. And you'll be able to join thousands of like-minded people. We have students, we have qualified practitioners, supervisors, a soupçon of tutors, all talking about issues in the world of counselling and psychotherapy. And this one came up, crying with your client. Yep. And I think it's one of the secret fears that a lot of therapists have. Should you cry with your client? You know what happens. And I think there's two sides to this. I have shed more than a few tears with clients, sometimes because of the material they're bringing and they're sharing their stories. And as a human being, sometimes you're listening to very, very sad, difficult stories, very, very difficult stories. But conversely, sometimes you are celebrating the therapeutic change, how the clients change their life. Tears of happiness, Ken.
Yeah, that's the interesting thing about tears, isn't it? That they can convey a number of different emotions. There's tears of joy. There's tears of being really proud of somebody. There's tears of sadness. And I think that maybe tears are painted with the brush of somebody's crying, they're sad. And we're not always. Tears are a way of us as a human being expressing an emotion. And it's interesting, we're focusing on the crying part here, but I think the range that is the rainbow of emotions needs to be celebrated here, because we're there empathically with our clients. We're going to go on the emotional journey with them. And I'm with you, Rory, with the fair share of tears that I have shed as I've been with someone in a really, really difficult place, and I've felt that emotion empathically. And I think the reason that this kind of comes with a warning light, when you look to the Facebook group, you're going to have different camps on this, is because, and this keys into what this is about, this focus on self, we need to be clear of where that emotion is coming from. Are we empathically sharing in this client's emotion, or are we keying into something that is in our own past, maybe something transferential?
Absolutely, Ken. I'm so glad you brought that up. I was hoping I'd mention transference first, but you beat me to it. and transference, of course, is that psychological time machine we sometimes find ourselves traveling in, where we attribute a relationship or a feeling from the past onto a new relationship in the future. So I've used this example many times. You work with a client, they remind you of a former teacher who wasn't very nice, and you bring those emotions from your past into the relationship. That's sometimes called counter-transference. So we have to be very thoughtful. And I think when it comes to shedding tears, we're only human. And I think that, sometimes we do that. But we need to think about the message it sends to the client. One of the messages that I used to say to students is, we share it, we shed a tear, that happens. But you may have to think about what that says to the client. Does it give a message of, oh gosh, my problems are so big that even the therapist, the counsellor's crying? And would that inhibit the client in any way? Would that audit the client because they didn't want it to get upset? And I always if I ever shed a tear with a client, I would always kind of preface it and say, the reason that I'm teared up is because your story is so powerful.
Yeah.
And but that won't stop me from hearing your story and being real and congruent in the room. And I think there's a difference between shedding a tear and absolutely bursting into tears. And I think I can think of, in my experience, one colleague many years ago who was going through an incredibly difficult time. And the client came in, talked about a breakup of a relationship, snap, the transference went in, and this particular person had to be escorted out of the therapy room in buckets of tears. And that is about your own personal self-awareness. It's also about being very realistic about what you can work with. And it's also about the diligent and, pointed use of supervision, making sure that if you've got something going on for you that is really, really hard, and gosh, therapists do go through some very difficult times, checking out, can you work with clients, because your material may just overwhelm you if it sounds like the client's material. We have to be very, very careful. But, in the final analysis, Ken, I think that shedding a tear is very human. It can show on a meta level that we're connected with the client and that what they're experiencing is real.
Yeah. And some takeaway points for me there, Rory. One that just jumps out and goes, wah, wah, is supervision.
Yes.
I mean, if you find yourself even empathically reaching a stage of tears with your client, it's always a good idea just to take it into supervision. Just take it in, have an explore of that with a peer who is there, looking over it with you, because we can, this transference, we can get caught in our own stuff, and the whole point of counselling is to remove as much of ourselves, yet be present as our full true selves. Work out the paradox there, if you will, in order to be there for the client. And I guess if you find yourself tearing up a lot, definitely go to supervision and explore why that's there. But conversely, if you find yourself tearing at an emotional point in a client's journey, congruence comes to mind. Be the person you are. Show the emotions that you are experiencing, because how often do we call on our clients and welcome their emotions in the room? We work in emotions. That's what counselling is. It is the emotional landscape that is so ignored by the rational world, that it's about what we do and how we do it and when we do it. This is a place where we can look not at the cognitive, but we can acknowledge the emotions, welcome your emotions, welcome your client's emotions, but in a professional, informed manner.
Yeah. And I think it's you're absolutely right, Ken. And I think it's a big ask to say to a therapist, if you feel upset, don't cry. Don't get upset, because, you're actually auditing the therapist. I've heard stories where people say, you shouldn't do that, unprofessional. And I think that you've got to strike a balance. And I think, for student colleagues listening, it's one of those things that students might fear bringing to supervision or talking about in class. And if this is happening to you, share it. Gain some insight from your tutors, from your supervisors, from your peers about what that's about. And also think very, very carefully about, is it because you're reacting to a sad story or the way the client is, or is it because in some way it links to your past or your circumstances in the here and now? If it's the former, well, you just have to think about maybe controlling that. If it's the latter, you may need to think about, how you're dealing with that kind of parallel process that's going on. Are you thinking, are the tears more for your situation than it is for the client?
Yeah. So we loop back at the end of this. The question, well, not really the question. The topic was crying with the client. And when I wrote this down, I put a little question mark on it, thinking, are we going to answer this question? What I realized as we get to the end, we haven't answered the question. We've discussed it as peers. And Rory are not here to tell anybody what to do in your counselling studies or your counselling practice. We're two peers that take topics that are discussed in our Facebook group or that Rory comes up with that we view as important. We have a chat about them, and we encourage you to do the same with your peers. Talk about these topics, because it brings, I guess, a further understanding, a deeper insight. And that's what we do. We're looking out for our clients all the time. And now we go into our Practice Matters. And in Practice Matters today, Rory, you met up with Sally Openshaw to speak about erotic transference.
Yes, it's one of those moments in therapy where either you find yourself attracted to the client, physically attracted to the client, or maybe your client's attracted to you. What do you do about that? How do you work with that transference? How do you rework it? And I spoke to the fabulous Sally Openshaw. I had a great conversation with her, and she tells us a little bit about her lecture she did for the Counsellor CPD Library on erotic transference. And this is what she had to say.
Practice Matters.
And we welcome Sally Openshaw, who has done a fabulous lecture for the Counselor CPD Library on erotic and eroticised transference. So, Sally, thank you so much for joining me.
It's a pleasure to be here. And it's a specific pleasure because this is often a subject that doesn't exist. And so I really thank you for making it much more overt and giving me this opportunity.
Well, thank you very much. And maybe we start there with it not being a subject that's discussed. Why do you think that is?
I think it's because there is some shame associated with it that as a profession we have managed to adopt. And my own training had many gaps around this area. I was taught very much about the ethics of not getting involved in sexual relationships with my clients. So I was taught very much not to go near the erotic transference. And so I think it has a layer of fear associated with it and a risk of extreme severe professional conduct happenings. And so I think it's put the fear into all of us about working safely.
I think it's very interesting. Even the term erotic transference seems very risque, doesn't it? It has a connotation to it. So I think, and I would be very surprised if anybody listens to the podcast who isn't sure what transference is, but I'm always interested in someone else's take on it. So, Sally, what is transference?
Okay, so on this podcast, I talk about different types of erotic transference. But the basic principle, I talk first of all about reciprocal transference. And that's when I get feelings in me in response to client material. And then reactive transference is when there's something from my history, it belongs to me, that gets activated by something that happens in the therapy session. And of course, there's a combination of both of those, where it might be a bit of mine and a bit of theirs that meets in the middle in that intersubjective space.
Yes. I mean, I think this is really interesting because, I would absolutely agree with you. It's something that never, ever gets discussed or is discussed in hushed tones. Should you meet a client and you find them attractive at some level, or they remind you of a past relationship? With all the mechanisms and the dynamics of that relationship, and you find yourself having a moment, as I like to call them,
It's really interesting. Those moments, as you call them, is a great phrase because it hits you suddenly like that.
Yes.
It has quite an impact. It might be body felt. You may find an arousal in your body, or it might be a fantasy that gets created.
Yes.
But, the thing that we never really appreciate is that we never really face up to the fact of what we create as therapists. A private space, we listen exclusively, we are there for our clients fully, we're super attentive, and we try and get it right around what they need. I mean, I can't think of a better lover than that.
Yes.
And then we're surprised when the eroticized material can come between us and a client. And yet we create such a special setting for that in the way that we present ourselves to our clients.
I think you've hit the nail on the head. And I can remember speaking to a group of students who weren't counselling students about counselling, and they said, "What was one thing that you kind of asked us to take away?" And I'd say, as therapists, we hear stories that you wouldn't hear on soaps. You wouldn't hear them on soaps. We hear the reality of people's lives, their desires, their loves, their losses, and part of that may be their sexual desires or their sexual proclivities, and we're a witness and a receptor of that, and of course we're human. We're human beings with all the kind of mechanisms that drive humans, I guess.
Yeah, I don't leave my sexual self outside the room when I go in to do therapy with people. It's part of who I am. And part of the work I do is want to normalise that there will be erotic exchanges between myself and clients. And what I need as a professional is to know how to manage those.
Yes.
And to actually use them well to provide more insight or more awareness, so that I don't just turn my head and feel ashamed and ignore it.
Yes.
Because I think the risk when we ignore it is, I do think there could be more of an ethical risk if we ignore what's really happening.
I absolutely agree with you. And there's an old saying, isn't it, that clients can only go as far as we as therapists are willing to go ourselves. And if we are embarrassed or overwhelmed by erotic material in the therapy room, we could subconsciously or even consciously kind of shut the client down and give the message that, well, this isn't acceptable. This is an area that we can't go to.
Yes, and there's some very typical reactions that therapists do when they're uncomfortable that actually adds to more shame for clients. So there's some very toxic responses that we could have. And so on the webinar, you will learn about those more toxic responses to be able to be aware, am I doing that? Am I doing something that is more shaming for my client rather than opening up and exploring and working with them? And erotic horror is a really important part of the erotic process. When we find ourselves really disliking or feeling really uncomfortable and horrified by our clients, that's on the same spectrum as erotic desire. It's just the polar opposite end.
It is. And I can remember a few years ago when I was teaching, having a student approach me who'd had a client who'd shared very intimate details of their, shall we say, their erotic lives. And they were so different, the practices were so different to my students that she was, first of all, she was astounded that people did she said, people doing these things, the inverted commas going into the air, and was completely stuck on how to work with the client. Does that, as a question, does that happen? Can it kind of halt the therapeutic process if what's being discussed is so outside the therapist's awareness that they really don't know where to go?
Yes, many people talk about feeling frozen and overwhelmed. And so one of the things we start with on the webinar is looking at people's reactions when it does come into the room, because that initial reaction is also quite important to pay attention to. And so the dis-ease that people feel and noticing what happens in them is really an important starting place. And then I will take them through a 6-step process to actually not only notice, but then face up to what's going on. And each of those steps, hopefully, will give them a structure that they can follow so that they feel really empowered to be able to work with the erotic material.
Yes. How often do you think this happens? We started off by saying this is in hushed tones. Is it more prevalent than we would like to think, do you think?
So there's been some interesting research around that. And the most common bit of research looks at boundary violations. So it's very easy for us to look at when it's gone wrong. And I think that's what I was meaning earlier about when there are ethical concerns, it becomes a very clear feature. But there's also some research that I will make reference to during the webinar of how frequently this does happen, how frequently people feel attracted to their clients or notice the attraction is present in the therapeutic space between them. But what's also very frequent is they don't have a clue what to do with it when it's there. And if that shame is present, they often don't even disclose it in supervision. So it remains silent and hidden and unresponded to. And for me, that's such a wasted opportunity. It is so useful to work with this material because it opens up a whole new area of awareness for the client and for you working with them.
Yes, and I can hear two kind of issues there, two very different difficulties that therapists could face. One is their own difficulty. In other words, not being able to go there, but the fact they're so ashamed that they can't even talk about it in supervision. So they're not bringing their clients for that consultative space to be able to process what's going on and on all the aspects that supervision gives. It is an ethical issue, really, isn't it?
Well, it leaves people much more isolated with it. It means that they lose relational contact, possibly with their clients and possibly in the most supportive environment, supervision. So there's a double loss of connection.
Yes.
And if they then shame the client by pushing it back on the client as well, then the client may also disappear from therapy.
Yes, and maybe worried about re-engaging with therapy with another therapist because that shame can be transferred onto the client, I guess.
Yeah, absolutely. We can project anything that we feel back onto our clients.
Yes.
And it's theirs to deal with. And so, yes, I think a supportive supervision relationship is vital. And one of the things I give on the webinar is if you can't talk to your supervisor, here's a self-supervision sheet that you could talk to yourself with to help you really understand and increase your awareness of how it's impacting on you, and then to consider where to go with it. Many people say peer group is the best place to go. It's much less, the balance in the peer group feels slightly less parental child or, a bit more equal. And so I don't really mind where people go, but going somewhere is important.
Absolutely. And of course, there's a chain here, isn't there? Because I guess that supervisors have to be thoughtful when they're supervising those who may be engaged in erotic or eroticized transference.
So if the supervisor doesn't normalise the presence of this in the therapy, it may be much harder for a supervisee to bring it. And so the research that's been done on supervisors' approach shows exactly that the initiation from a supervisor to expand the work for this to be a part of it is vital to lead the supervisee into discussion.
Yes, I mean, I think you've shone a great big torch into an area of darkness here, and I'm sure that people will be listening. That I think there'll be some signs of relief. I think there'll be people listening on their earphones, going, "Oh, not just me." And I also think that it should generate a discussion in supervision. Usually at the end of the podcast, I ask guests what they hope that people will take away from the lecture. You've given so many hints, but just as we come to the end, what is the biggest takeaway you hope that those who watch this lecture will take?
What I hope they'll take away is a belief that they can do this with support, and that not only can they do it, that it would be quite normal for them to do it. And I also hope they'll get a process by which they can follow, a step-by-step way of thinking about it so that they can be effective in practice.
I think this is a not-to-be-missed lecture. So important, so under-discussed, and so much in service of our clients. Sally Openshaw, thank you so much for joining us.
It's my pleasure. Thank you for having me.
Big thank you to Sally Openshaw and to you, Rory, for hosting that interview there. Really interesting topic. And if you're listening to that and you're thinking, wow, I'd like to delve a little bit deeper, you can. If you're a member of the Counsellor CPD library, log in. Sally Openshaw's lecture on erotic transference is right there. You can have a listen to that. If you're not a member of the Counsellor CPD library, go to counsellingtutor.com. All the information you need is right there. And Rory, this has been episode 210 of the Counselling Tutor Podcast.
I know we never get a chance to catch our breath here at Counselling Towers, and we looked at some really, really interesting topics. The first in Counselling Foundations, attending, being present, being really attuned to your client throughout the arc of your engagement with them. Then we went on to focus on self, crying with the client, shedding a tear. How do we manage that? What do we need to consider? And then finally, we talked, Sally Openshaw gave us a wonderful interview on her lecture about erotic transference. And as always, stay grounded and stay safe.
If you're a qualified counsellor or psychotherapist, then why not check out the Counsellor CPD Library? Stay current with your CPD requirements with over 150 hours of academically rigorous, on-demand lectures you can stream to your device. Joining Counselor CPD will expand your skill set to create a more specialised, highly rewarding practice. For more information on the Counselor CPD Library, visit counsellingtutor.com.
Thank you for listening to the Counselling Tutor Podcast. Find the show notes for this episode on our website at www.counsellingtutor.com.